So we're going to be talking about some aspects of cognitive analytic therapy, how, what does it have to offer, how it may or may not be relevant in your context, how is it suitable in the Indian context. I think these are some things we are hoping to answer or maybe at least comment on. So for those of you who've not come across CAT at all, hopefully this will spark some interest for you. And further on, the other information is also, we are doing this event in connection to the upcoming Level 1 CAT training, which is based on the International CAT Competency Framework. This is a two-level course or two-level training, where the upcoming training is Level 1. So that is a one-year program. And from there, this will involve a few days of teaching, so about 60 hours in terms of teaching, training. Additionally, there are going to be some seminar groups, and there will also be supervision. So supervision would be offered by CAT supervisors. So individuals who are interested and who would like to further certify in CAT, this might be the first step towards it. This is going to be Level 1. And further from there, Level 2 is the CAT Practitioner certification. Currently, this is the highest level of CAT training we have available in India. So the upcoming Level 1 training, which is the 60-hour program, is going to commence is also probably to answer some questions which some of you probably have in the context of this training and would like to ask. Yeah, so I will probably proceed with some of the initial questions. So let's say, so what do people generally think trainees struggle with most when trying to learn CAT? I think that's always a very interesting question, where one thing is, in my experience, what I've noticed is that just understanding the concept of change in CAT, where change is looked at as any small step which is an alternative or which is different from what their usual patterns are, is considered a movement towards change. So I often have people saying, well, but that's not exactly change. That's just a small step. So how do we call that change? So that, I think, is one aspect that usually people struggle to accept, saying, well, this is what change looks like in CAT. And the understanding how change looks very different for each person. So somebody who comes in with, let's say, two individuals coming in with the same presenting problem, the work as such might look very different. Also, the pace of change can also look very different. So unlike certain models where there is a fixed goal and the idea is no matter what, the client needs to move from A to B. Here in CAT, we are saying, well, we are trying to move from A to B. But at the same time, let's also think about what is realistically possible for this person, considering the context they live in, considering the resources that they have, considering the emotional capacity that they have, considering what change has to offer for this person. So there are a range of factors that come into picture. So it is not just we move from A to B, but we also look at, well, is A to B possible for this person? If A to B is not possible, what is realistically possible? And how do we move towards that? So that's the general understanding. And that's something I think people often struggle to sort of wrap their head around, saying, well, but we still need to get there. Another question is, what do you think makes a reformulation feel genuinely collaborative rather than something the therapist has figured out about the client? So when we talk about reformulation, where some of you may have already read about reformulation or are probably familiar with the idea of reformulation, which is essentially using the CAT framework, to conceptualize or to formulate the individual's life or individual's experiences, etc. So in CAT, when we think about the idea of formulation, which every model talks about case formulation. Here, when we talk about formulation, reformulation is the term used, where we say we are using this framework to reformulate this person's life experiences, and this is discussed with the person. So right from the first session, it is very collaborative in nature, where I, as the therapist, I do not take an expert stance with a certain perspective and then view my client from there and keep that information with me. It doesn't work that way. Everything is usually discussed with the client. So we walk along with the client saying, well, what does this sort of mean for you? How did this experience feel for you? How did it land on you? What meaning did you make out of it? So all of this information is discussed. And when we get to the reformulation, which is essentially around the fourth or fifth session, where the reformulation is written in a letter format that is shared with the client. So by the time we get to that, we have already discussed all of this. So when we do the reformulation, it is not a surprise. It is not something that the person never knew about. This is already stuff we have discussed. And, the reformulation letter only stands to connect the dots and put it all together in one letter and read it out to the person. So all it does is to connect the bits, but there are no surprises. And hence a letter, in some sense, is also a joint entity where none of the material is my own. This is what the client has shared, and this is what we have a right at saying, this could have led to this, and this could have led to this. Most of which are hypotheses, but at least putting all of that together is what the reformulation stands for, and that is quite collaborative in nature. And parallelly, I think the other question is how important is personal reformulation in becoming a CAT practitioner? So that bit, I think, is a very significant one when we talk about personal reformulation for the therapist. And in the CAT world, having some experience of personal reformulation is always not just advised. It is always encouraged that anybody who is doing CAT work or in training in CAT, they also have some personal CAT therapy work that is done as well. And the idea is when we walk into the therapy room, the understanding is that we are not walking just as a blank slate. I, as an individual, walk in with my own experiences of relationships, my connections or my relationships with not just people, but things, events, with systems, with culture, with beliefs, with attitudes. So there is all of this that comes into the picture. And the idea is while I'm with the client, I'm not just, I can't keep all of this outside. There is a fair possibility some of this can also play out in the therapy room with the client. Where as I'm relating to the client, there is a fair possibility that some of these patterns can also play out with the client. And hence being able to have some personal experience for myself, some personal experience of CAT personal therapy work helps me in some sense to also be able to keep that information in mind while I'm relating to the client, which means there is transference and counter transference, but I'm also talking about not everything in the room is just the client, nor everything in the room is just me, but parallelly at the same time being able to sort of section it out and say, yeah, this is my material, which my own experience of personal therapy would help me identify to some extent. And how can we use that information in the conceptualization with the client as well? That is the other aspect that comes in. So hence, personal reformulation becomes a really significant aspect of training to be a CAT practitioner. So Siva is here, has worked out. So Siva there. So when you look back to your own training as a CAT practitioner, what do you think was the hardest shift for you to make?
So hi everyone. First of all, I'm really glad that I got in. It was a strange experience being stuck outside and trying to get into this this platform. So the question about transition and getting into this training, it was quite a transition for me. So my primary qualification is MBBS. So I am a medical doctor. And I went on to train in psychiatry and then psychotherapy. So in my medical training in physical health, we are focusing a lot of our energy on like finding clues from the body. So we maybe rely a lot on what we call as signs. So there is a sense of this is typically viewed as something more objective. Interestingly, good clinical medicine also depends heavily on the clinician being able to listen to the patient's story. So that is something, and listening to it quite carefully. So that is something I enjoyed even in my medical training. And slowly, after starting out as a psychiatry postgraduate and then working in psychiatry, it was a greater shift towards staying closer to the person's like subjective experience, so as to say. And eventually getting into psychotherapy training and particularly CAT training, it felt a lot like a bigger invitation to sort of become more comfortable with someone's subjective experiences. And for me, that was the main shift and a challenging one at that. And I think it was also a big invitation to kind of stay open without forming any conclusions. So I think that was another shift, and I think CAT for me supported me a lot in that transition, and the training in particular, working with a group of professionals from a variety of backgrounds. My training cohort had professionals across the field. We had doctors, nurses, occupational therapists, clinical psychologists, and that was a counselor. So that was a very rich experience for me and an important one as I made this transition.
Right. So when we then think about, let's say, CAT work, working with clients, recognition is usually considered like the first step towards change. So how, difficult or easy do you think that is generally for clients, the recognition part?
Right. I'm glad you brought that up in some sense, because I think in CAT training and in CAT literature, there's usually a lot of emphasis on the reformulation phase, as it is in other psychotherapy models as well. I suppose a lot of writing and thinking about formulation as such. The recognition part in CAT traditionally is the second phase of the therapy, where the therapist and the client focus on becoming more able to spot events as they happen for that person. It might be a certain action that the person takes or a certain feeling. Sometimes it might start uh, in a very subtle way. It could even be about how the person moves, for example. All of that can be clues into what we call a certain role that the person might be entering. And in CAT, we call it the reciprocal role. So in the recognition phase, we are really trying to observe that, become more familiar with that. And in CAT, that is thought to be a very powerful experience that can perhaps remove the rigidity of those roles, or somehow loosen the hold of it over a person, allowing the person to maybe make different choices with regards to how they respond to themselves or to others or a particular situation.
So now when you think about your own practice, can you think of any one moment in the context of revision with any specific client where even like a small shift was a significant one? I remember something, maybe I will add that.
Mm.
I remember with a particular client where one sort of pattern we recognized was every time they were ignored by anybody, so anybody sort of ignored them, it would immediately trigger them into an almost different state, where they would suddenly become very the person's face. So at some point, between us, we considered how about naming that, that state, giving that a particular name. So we picked a name which rhymed this person's name. So something like, let's say, if the person's name was Sita, then we named this other part Geeta. And then and we sort of enjoyed doing that because she seemed to sort of enjoy it. She said, "Oh, it's nice to have a name for that part of me." And I remember when she came in for the next session, this is all we did in that session. Next session, when she came in, she actually spoke about a particular event where she said something with her partner. So the partner said something which immediately, triggered this state for her. And then she said to herself, Geeta, no, now it's not your time. And she was able to step back. So she came back in the next session and she was really sort of surprised at how she could catch herself before she got into that. So then for me, it stood out as all we did was just give it a name, but that seemed to sort of concretize it as if then she could have a relationship with that part of her, as if then she could maybe even speak to that part. So that's one thing that sort of comes up for me when I think about this. Yeah.
Mm. I suppose that kind of shows nicely how the recognition part is really powerful. And also, it happens in very small moments and small
Mm.
steps. So, I'm now reminded of something with a young person. But before that, I also wanted to say how in CAT, one of the competencies is to set realistic expectations in terms of therapy outcomes, and how these we are talking about these change in these small moments and small steps. So I'm now reminded, when it comes to recognition, I'm reminded of a young person whom I worked with some time ago, and I remember this phrase that she said towards the latter part of therapy, and it kind of stayed with me because I thought it was also an interesting way of putting across something. She said in one of the sessions how, oh, I now see that you are my therapist and not my lawyer. So that I
Interesting.
thought was a very powerful statement that she made. So this was a young person who was struggling in many parts of her life, education and friendships. And most importantly, she was having a great struggle with her mother, and for her, it was nearly impossible to imagine how she can move in any direction without her mother making significant changes. And uh, the early parts of therapy, a lot of time and we spent a lot of time together, trying to see what can happen for her, what she can make for herself. And when she made this statement, and she went on to tell me how she finds that she can come back to herself and she can try to be with herself, and that's what we've been doing in this therapy. And it's not she can actually take a step aside from this battle that she was in with her mother, where
Mm.
she became immovable in a sense,
Right.
and stuck in many ways. So that became quite an important moment in the therapy, and it looked like it almost freed her, like, and freed the therapy from going into, of course the relationship with her mother was and is a big part of the what we were addressing in therapy, but somehow
Mm-hmm.
it gave her, it was as if she was announcing her that she can also take steps, and I didn't have to advocate for her. I can only be her therapist. So yeah, that comes to mind. Like,
I think that also adds the bit about what change looks like, no, in CAT, where
mm,
it can be so different for each person, and brings up the whole question about therapist expectations in therapy as well. You know, what do we expect and hope for our clients? Does that even match with what the client wants? And whatever expectations we have, is that even relevant? You know, relevant,
mm.
is this what the client wants? And, you know, whatever I have in mind, is that what change really looks like for that person? I think that's a question that sort of CAT probably raises as well with the concept of change and exits in the model. So, yeah.
Yes, yes, and I suppose it's also sort of formalized in the first phase. By the end of reformulation, the
Mm,
general expectation is that the therapist and client have a shared agreement on what they want to address in that therapy, and the attempt is that both of them are able to arrive at that in a way where they have worked together and they have looked at the problems together, and they have been able to, and in CAT, I suppose the emphasis on using the person's language, the joint language aspect, where, or
mm,
shared language, where the therapist is listening into the person's own vocabulary or person's own words, and using that to write the reformulation letter or the map, where then they also have a clarity over what they want to address. So and I suppose this happens at different speeds for different patients or clients, and that's where I think CAT is really flexible and
mm,
allows every therapy to be a personalized therapy, if I can say that. Like,
mm,
it's a unique therapy that emerges between that therapist and that client. Like, although the model
mm,
is somewhat structured and it's
mm.
practiced in the same way. Yeah.
Yeah. Okay. Yeah. Maybe we will do one more question and probably wrap up with that. So when does this approach feel most powerful in the therapy room? You know, maybe from each of our experiences, what probably stands out?
Yeah, so something very immediately comes to my mind. And I think that is that tension between when a person comes in with uh, difficulties that they might be locating in themselves. However, very often difficulties that are located in relationships. I think CAT is very suitable in terms of addressing that, because CAT essentially views people as having developed inside relationships and continuing
Mm,
to exist uh, in systems. So I think CAT very helpfully locates difficulties in that space where that tension as to between the individual and the system, and I think CAT embraces that quite nicely, and I find that quite helpful even in the clinic, where I'm able to talk about complex difficulties in using this framework, even when I'm not doing therapy, um,
mm,
to talk about complex things like personality, um, and so on. So I think that way CAT really helps.
yeah, right.
Pavitra's put up a question about the training that's coming up. If you've not mentioned already, Anne?
I mentioned it briefly at the start, but Siva, do you want to mention it once again for others who
Hmm.
probably joined in later?
Yes, yes. So Anne and I are absolutely thrilled, we can say, to be introducing the Level 1 Cognitive Analytic Therapy Practitioner Foundation Program. We are introducing this in partnership with the PARC. This is going to be a year-long training program. It has a variety of components. There are some teaching days, small group work, small where trainees will be reading papers, and there is the clinical component, and there is going to be supervision with some very experienced supervisors who are on the course with us. And this training is expected to lead into the next level, which is level 2, where then someone can qualify as a CAT practitioner. And level 1 equips the person to start using CAT within their practice. And we are open for applications, and we look forward to hearing anything. You can write to us. You can write to the PARC. Maybe we can leave some, like an email ID or something where you can show us your interest. But the applications are also open. And we'll be very happy to hear from any of you.
Yeah, the applications close by the end of this month, and the course will commence in September. So if any of you are interested, now is probably the time to consider applying. And just to also add, the application process is also designed in a very CAT way, where CAT is very relational in nature. So we've kept that in mind. So irrespective of whether you take up the course or not, the application process as such can also be quite reflective, just inviting you to think about various aspects. Okay, so I guess we will stop with that then. We might see some of you eventually, or like Siva said, yes, please reach out to the PARC, and we will leave an email ID in case any of you want to reach out to us directly, and we can answer some questions if there are any further. Thank you. Bye-bye.
Thank you, Anne.